morning, everyone. Good morning to my dear students.
Good morning.
Yes, I am Associate Professor Dr. Teo Nguyen from University Kuala Lumpur, Royal College of Medicine, Perak, Faculty of Medicine, Surgery Department. Today, I am going to demonstrate how we do breast examination. So all these 7 students and cameramen also, 8 of them are my BCC Year 3 students, Basic Clinical students. So I'm going to demonstrate today about how we do breast examination. For that, before approaching the patient, we have to understand all these steps. Approach your patients nicely, humbly, down to earth, friendly manner, and approach nicely. And treat them like your own relatives. Now, we are going to examine the breast. That's me. First one is you introduce yourself. In the OSCE exam, Objective Structures Clinical Exam, you may find the simulated patient first, because we are going to examine on the mannequin only. So there, you have to introduce yourself, who you are, and ask the name of the patient, age, their job, married, how many children, and their education level. After that, you call the name quite often. So after that, you explain what you are going to do. So ask for verbal consent also. After that, reassurance. That's me. Okay, I'm going to examine. I won't hurt you. I'll be very gentle. So after that, you approach already. You get the permission already, and you are going to examine. Now, for the mannequin, we kept as the recumbent position. But in true case, we can examine the patient. Sitting position, standing position, and bending forward positions, and with the hands behind position, so that we can look at any swelling in the axilla. And if you want to examine attachment to the pectoralis muscle, you can press, the patient can press on the buttock this way. So these are different positions. Now, with this position, recumbent and a towel under the right arm. So this patient is a 48-year-old female patient, mother of 3 children, having breast lump in the right side at upper outer quadrant. So now I'm going to examine this patient. Actual examination, before examining the affected side, I have to expose another side and examine as well. But because of other abnormalities, I don't want to. And now, first one is, we do need to have a good, adequate, and appropriate exposure from here up to the waist. So already exposed. Now I'm going to examine the right breast. So right breast, we are going to look at, and first one is the inspection. During the inspection, although there are none or something, we have to include all the possible positive signs. What are those? For example, skin, apart from a little bit bordering here, there are no puckering, no swelling, no dimpling, no discharge, no ulceration, no eczematous lesion, and no engorged veins here on the skin. So on the nipple, there is little bit retraction, but no deviation, no discharge, no eczema, no ulcer on the nipple as well. So after the inspection, now what I'm going to do, I'm going to palpate. So palpate means we can apply 3 methods. You can move around a little bit. So 3 methods mean, first one is circular method. So you have to include even the circular method, axillary tail as well. Don't leave behind the tail of Spence. So after the circular method, you can apply another method, we call it split method. Medial half, you palpate. Lateral half, you palpate. And last one is the wedge method. That means wedge section of each and every segment, you palpate. That is the way. So now I'm going to apply circular method. I know already there is a heart lump here at the upper outer quadrant of the right breast. So for that, to know exactly the location, we have to correlate with the o'clock position. That o'clock means here from 9 o'clock to 10 o'clock position. Here is a lump here. Okay, site is 9 to 10 o'clock position, and another correlation is 3 centimeters away from the nipple. Okay, size is 3 centimeters diameter, shape is rounded, consistency is hard, surface is smooth, and quite fixed, not mobile. The margin is well, okay, defined margin. That's all. And on top, it's not attached to superficial skin, but it is quite fixed to underlying. Being mannequin, I cannot. But in true human case, ask them to press on the buttock. By that time, pectoral muscles are contracting, and I will try to move. So that will be fixed as well. So that's all. So I have examined this swelling already. After that, now I am going to examine the axillary area. Come. Okay, what's your name? Okay, Ahmad. Excuse me, I'm going to examine you. So being on the right side, I'm going to use my right hand. Elevate it, you just relax. Don't move up. So with that, now I'm going to palpate 5 groups of axillary lymph nodes. First one is pectoral lymph nodes or anterior lymph nodes. Second one is central nodes. Third one is subscapular or posterior lymph nodes. And apical nodes. That this is lateral lymph nodes at the arm. So these are the groups of lymph nodes. If I can get any enlarged lymph nodes, I have to note down how many numbers, what is the size, fixity, mobilities, and so on. So after that, after these 5 groups, I have to go another step. That is called, here is the deltoid muscle. You all can feel yourself as well. Deltoid muscle and pectoral muscle. We call it deltopectoral group or infraclavicular group. Here I am feeling that group, none. And another one is a supraclavicular. Ask the patient to shrug the shoulder a little bit. Okay, and then I can feel better. So now, none. After that, deep transverse cervical is the final one. So that's how I will examine the lump and then the axillary lymph nodes. After that, so the question we can ask is, any other organs you would like to examine to exclude metastasis? That means there are 4 organs. That means liver, lung, bone, brain. Very simple. For that, liver, you have to palpate for the liver enlargement. At the same time, you do percussion and then the shifting downwards to exclude ascites, as well as if the patient is a reproductive age, there could be Krukenberg tumor. So feel for the enlarged ovary. That's all. Okay, next one is the lungs. For the lungs, come from the back, you percuss and exclude stony dullness, presence of effusion, and any area you listen. So any solidifications or change of the respiratory sounds, and ask the patient, are there any cough, hemoptysis, or chest pain, or difficulty in breathing? That's all. Another one, come sit down here. Okay, for the bones, very quick, I'm going to palpate for the vertebral bodies, thoracic cage, pelvic bones. Long bones are humerus and femur, plus scalp bones, 6 steps. These are the bones I'm going to look for swelling or tenderness or secondary or pathological fractures. That's how you excluded the bone secondaries already. Okay, finish. Next one, the last one is brain. For the CNS spread, I have to ask history from the patient. Any increased intracranial pressure, patient may have nausea, vomiting, headache, blurring of vision, double vision, or any weaknesses of any limbs, plus little bit of the ischemic attack, or seizure, or unconsciousness already. That's all. So we exclude all these 4 organs spread. So finally, my diagnosis is cancer breast of the right side at the upper outer quadrant, 9 to 10 o'clock position, 3 centimeters away from the nipple. Other than that, I don't find any other secondaries in the axilla or any other organs, something like that. Okay, thank you very much. Any questions from my students? Do you understand very well about so later on you can come and practice how to partake the breast lump in the mannequin. Okay, thank you very much.